All right, Patty, take it away.
All right. Well, welcome everyone. Thank you so much for joining us on a Friday late afternoon on a 3-day weekend. We really appreciate you taking the time out to join us on the call. Debbie, go ahead and advance the slide for me.
Okay. Well, wait, hang on. Not going. Come on, guy. There we go.
There we go. So you are all our deputy ambassadors for the state of California for the Learn the Sign to Act Early State Systems Grant. And this grant is actually funded through the Association of Maternal and Child Health Programs. We applied to participate for a 2-year cycle, and we're really excited that you all chose to be a part of this grant. Next slide. So as deputy ambassadors, you basically have 2 tasks or 2 things that we're looking for support from you all to do. The first one is to assist us in the development and distribution of a regional Learn the Signs Act Early brochure. It's the Milestones Moment brochure that will be individualized for each of the regions within our state, with contact information for the Family Resource Center, the regional centers, the SELPAs, and or a single point of entry contact entity that's identified within each region to help families get in contact with the resources they need if they have concerns about their child's development. We also are looking for assistance in providing Learn the Signs Act Early presentations within your regions to share the resources and to get the information out to providers and physicians and families so that they know more about Learn the Signs Act Early, the campaign, and the resources that are available. Next slide. So each of you should be receiving in the next few weeks a draft of your regional brochure. And we've enlisted the support of some of our LEND trainees at the UC Davis USED and the USC USED to help us with this work. So if you're in the Central or Northern California area, you'll be receiving communication from Kirsten Yates. She'll be drafting your brochure and sending it to you for additional feedback. And if you're in Southern California, one of the trainees from the USC USED, either Christine Turnbull or Mary Milback, will be contacting you for feedback on the draft brochure. Next slide. So your job, once you receive the draft brochure, is to proof it, to share it with your captain regional team members to make sure that it is all correct and that everyone's included, and then to give final approval to the LEND trainee so that we get authorization to go ahead and run it for print. Next slide. You're also going to be working on developing a distribution plan for your region with other members of your captain cadre. So making a determination about who you want the brochures to go to and keeping track of the number that are going to each entity within your region. We will actually print and ship brochures to you, the initial run that the grant covers, to you, and then we ask that you would distribute them to other cadre members based on your regional distribution plan. We also are going to be developing a survey and sending it to each of you so that you can give us information about how many brochures you've disseminated and to whom. So that'll be a quarterly web-based or email survey. Next slide. What you see on this slide is an example of one of the regional milestone brochures. This was the one developed for the capital area. And each one, of course, will look different because it will have just the contact information for your region. And some regions have more agencies than others. Some have fewer. Some are using a single point entry. So they'll be adapted and fit to the milestones template to reflect whatever information you decide should be on your region's brochure.
Patty, this is Fran. Can I just throw in something real quick? If you're in LA County, we actually have 5 regions in the county, but we'll be developing one brochure, so several of the deputy ambassadors will be working together on that.
Thank you, Fran. Next slide, Debbie. The other duty and support that we're looking for from each deputy ambassador is to provide presentations within your captain region. And many of you at the summit received a binder full of the Learn the Signs, Act Early materials that you can use for presentations. We know that there were more of you that signed up than we anticipated, and we'll be getting additional binders out to those who need it here very shortly as soon as we can get the materials and get them together for you. Information on how to order the Learn the Signs, Act Early materials and resources are part of that binder, and we'd love for you to give that information out as well so people know how to access and get these materials from the CDC. And then, as I mentioned before, we'll be asking you to report any trainings or presentations that you've provided within your region on a quarterly basis via the email or web-based survey. Next slide.
I think that's it for you.
Okay.
So, are there questions before we move on for Patty about the duties for the deputy ambassadors? You can either raise your hand or you can type into the chat box. And you can type now. Okay, I see Patty, you have your hand up. I'm going to try and unmute you. Let's see if we can connect you. Okay, you're unmuted, Patty. Can you speak to us?
Hi, how are you?
Great, we can hear you. Thanks. Go ahead.
Perfect. I just was curious as to how lengthy or in-depth these presentations are expected to be. Are they just like dropping in at a hospital and, you know, giving a little 10 or 15 minute blurb, or what exactly that entails?
Debbie or Fran or Monica, you're welcome to answer based on what you've done, but as far as the grant goes, we didn't indicate the length or the audience that you'd be talking to, so it really is going to be up to you guys to identify which audiences might benefit from this.
Okay, so if...
And in fact, the presentation you do will often be based on what your audience wants. So you may have someone who says, oh, you know, we're having a faculty meeting or we're having a staff meeting. Can you come in and do a 15-minute presentation? Or you may get someone asking for something more in depth. But we'll also, later in this presentation, we'll talk about some of the resources for putting together a presentation.
Okay, so if we already have some workshops scheduled, professional development workshops or parent workshops scheduled, and we just include a 10-minute discussion about LTSA in that, you would want us to keep track of that as part of a presentation?
Yes, please.
Okay, all right, thank you.
Thanks, Patty. I'm going to mute you again. Okay, let me just check and see if anybody else has their hands up, and I think we have a written question here. Let me check that. When will the binders be sent out? Excellent question. We have to order some materials, so I don't know. Patty, do you have a time frame in your mind, or is it more as quick as we can get them out?
Well, we'll get them to you as quickly as we can. The CDC is actually pretty quick with turnaround most of the time, so as soon as we're able to put in the order to get the materials, we'll put them together and ship them out to those of you who don't have them.
Right. Thank you. Thanks for asking. Okay, we're going to do a quick overview of the materials, and I hope you'll bear with us. I know you guys saw these in person, but we just wanted to do a quick overview so everybody's kind of on this, has had the same information. as you go out into the world. So again, they were developed by the CDC in conjunction with the American Academy of Pediatrics. They're objective and research-based, and they empower parents to become more involved in tracking development. Free, lots of different ways they can be ordered, and they can be customized. So if you're talking to another system or agency or organization that's interested, that's always a great selling point. If they want to be able to customize them and put their own agency's logos on them, they can do that, and the CDC can help them with that process. All in Spanish and English, and also some additional languages. And if you are, again, talking to a group that has a particular need, a particular language need, you can come back and get in touch with Monica or Fran or myself, and we can check with the ambassadors across the country who have, in some cases, done some, languages in their areas that they have needed, and might be the same ones that you're looking for. So again, designed for use by parents, they're designed for use by professionals, and they're designed for use by parents and professionals working together. And we'll kind of touch on that a little more as we do the individual items. So the brochure is similar to the one, it's the same brochure that Patty just talked about, that we're going to be doing some customized brochures for each of the regions. And if folks are interested in ordering the more generic one from the CDC, again, this covers all the milestones at a glance. It's a trifold. I think they come in packs of 50, so they're one of those things that you can order a larger quantity of for folks who want to be giving them out at their particular centers or programs. So those are one of the core resources that are available. And then the Milestones Moments booklet, which takes each of the age ranges and really expands on the milestones and how you can help your child develop, and red flags. And so this is a great booklet for programs to be handing out to new parents, or to parents when they come to their program for the first time, because again, it fosters that knowledge base in families to be able to look at milestones, and it gives them a great tool to go to a doctor and say, hey, I'm kind of concerned that this isn't happening, and they've got the weight of the CDC behind them in their concerns about their child. Great posters are available to be posted in areas where families are waiting, bulletin boards, that kind of thing. Lots of times programs are looking for things to post and to keep things interesting, so those are also available. Growth charts, fun thing to give out to families because they can put them on the wall and all the kids in the family can use them. And I think it's a great idea if you see a family repeatedly, that you could be the one that takes the pictures that could be posted on there, since I don't know how many families still actually print pictures on paper. So that would be a fun activity at different centers. And then the books, Amazing Me, available in Spanish and English. This is, I think a lot of you got a copy of this, or at least got to touch it at the Captain Summits. And so these are available to order, to be able to give out to families, or to share the information with families so that they can place an order for their family individually. Also can be downloaded as an iBook, and on the website you can actually go on and click it and it will read it to you. So even if folks can't get a physical copy of the book, they can still access the materials. All right, Monica, I'm turning it over to you.
Hello, hello, hello. Can everybody hear me okay?
Yep.
Can you hear me okay? Oh, great.
Well.
So, great. The next item that we're talking about are the milestones in action. And I know some of you are following us on social media and have seen some of the examples of the photos and videos that come from milestones in action. So there are different photos and videos ranging from children from 2 months to 5 years old, and these pictures and videos show different milestones across the different domains. And so they're really exciting to share with families. You can embed any of these resources in trainings that you provide, whether it is a 5-minute training or an hour-and-a-half training. You can refer families to the website to check out the milestones in action. You can share these on your social media. I think I can advance 2 slides. One more. There we go. And then the Watch Me training. That's okay. This is fine too. Either way. So Watch Me. If we go back, the little guy's cuter, so we can go back to the little guy if you want. The Watch Me training is another training that you may choose to do in a large group. This is a training that was created for early childhood educators, and it will help them to understand their important role in monitoring children's development on a daily basis. It also addresses how they can have conversations with families about monitoring development. And then there are some great videos about how to have some of those harder conversations with families, especially when concerns might be present. So this is available for people to do online themselves, and they can get continuing ed units, or as I said, you can use the facilitator's guide and conduct it in large groups. And I've done that a few times, and the results have been great. People really appreciate this training, and pretty soon it's going to be available in Spanish, like any day. So the great thing about being a deputy ambassador is you will know immediately when things are available in different languages or new materials. Next slide. Oh, the Go Out and Play kit for early educators. You may have received a copy of this at one of the Captain Summits, but this is another tool that you can just print directly from the website, and it gives great tips for early childhood teachers on how they could set up their environments to observe for different milestones. In this booklet, there's also tips for talking with parents, especially when there are concerns, and there's a one-page that you can tear off from this kit to actually send home with families so that they can have ideas about activities to set up to promote optimal development and monitor developmental milestones. Next slide. Autism case training. So this would be great if any of you wanted to brave the path and actually conduct or some of the autism case trainings in your captain regions. And if you're not ready for that, that's okay. At least spreading the word that the autism case training is available, that would be fantastic. They can actually get continuing medical ed units, their nursing units, or CEUs. I'll often talk about how I love the videos in the video library. Even if you're not going to do the full autism case training, you can have access to some great videos that give examples of little ones and what their behaviors might look like if they're on the autism spectrum. There are 2 parts to this autism case training. There is the actual curriculum that has been created to use for residents while they're attending their residency school, or there's the online modules that you can participate in to learn more about identifying autism. And I think our next slide will give us a little more information. Next slide. There we go. So early warning signs, screening, communicating concerns. For the medical field, you know, what does it take to make the autism spectrum diagnosis? Early intervention and education. It'll talk about different treatments and give examples of anticipatory guidance. Next slide. Please, thank you. Okay, so this was a slide that we created when we were waiting for these 3 new items, and now 2 out of the 3 are here. Many of you have also now seen the Where is Bear book, which is available in English and Spanish in very limited quantities. For you can order 1 in each language from the website, but remember, you can always customize these books as well. So this terrific tale for 2-year-olds talks to us about this little guy's journey reaching his developmental milestones while he's 2 years old. And the other thing that we were waiting for were the milestones in action, but they're here. But any moment we are going to be getting the milestone tracker that will be available for the iPhone and the iPad. Once this comes out, it's going to be a way for families to track their children's development using the Learn the Signs Act early materials, but in an electronic form. It's also going to shoot reminders to them when it's time for their child to have a full developmental screening. So this is going to be great, and you, once again, as a Deputy Ambassador, will know exactly when this is available. Next slide, please. Like us on Facebook. Raise your hand if you already like us on Facebook. Deb, you're looking at this, so you'll have to give me the count. So liking us on Facebook is one way that you'll be able to access new information, but we also hope that you share the Facebook option with families that you work with, because we really want families to keep in mind, you know, the importance of developmental monitoring, promoting optimal child development, and we can ask parents to go to the Learn the Signs Act early website, and we hope that they do, but it'll be easier for us to give them information in digestible bites if they follow us on social media. Next slide. Please, next slide. I think the next one is to follow us on Instagram. So I think we're up to like 40-some followers now, so that's pretty exciting. Every day I get a new follow, I do a little dance. But once again, information can be shared through social media, both for professionals and parents alike. So it's one way for us to help spread the Learn the Signs Act early campaign. And I think the next slide might be passing on to Fran.
Yeah, I will say that Monica is really fast too, boy. Lots of times I haven't even finished reading the email that came in that announced a new something or other, and she's already got it on Facebook. So you really will be the first ones to know, because she really keeps that going. Before we go on, Fran, Patty, we've had a request before we end the webinar to review the Deputy Ambassador duties again. So just want to put you on notice, maybe before Fran takes us out to the website, we'll have you do that.
And can I ask a question? I'm curious, since attending the Captain Summits, have any of our new deputy ambassadors started using these materials in a new way?
Oh, okay. So maybe we can have you raise your hands if since the Captain Summit you started using the materials in a new way. We'll give you a chance to do that, and then
yeah, they can type it in the chat box.
Let us know what's going on. So, okay, so Fran, I'm going to advance for you.
Do we want to see if there are any other questions, or just go through and then do all the questions at the end?
Actually, why don't you do the order card, and then we'll do questions before you take us out to the website.
Okay, great. So, so basically there are 3 ways of getting materials. Certainly you can print them off the website. There are also little discs that you can get that have all of the materials on them, and then ordering materials from the CDC. We also put together little postcards, so if you're going out and you're doing a presentation, this postcard is available for you to take out with you so that people know how to get the materials easily. You know, it's very easy once you go to the website, but a lot of times people, you know, say, oh, I don't know how to order the materials. You can pass out these postcards. These were done in California, so you cannot order them through the CDC, but if you contact Monica, Debbie, or me, we'll be happy to get postcards out to you. Okay, next slide.
Okay.
Okay.
So let's see, you know what, let's do a couple, I'll show these really quickly, and then we'll come back and let you do that. So we've got the contact info for the ambassadors here, and we're going to post this PowerPoint, I believe, on the Captain website, so you can get it through there. And I think the contact info is also there. And then Patty wanted us to share all the people who are involved in the state systems grant, which is helping to support this particular activity.
Okay.
And then you want to talk about this, Fran, and then we'll...
Sure. So after this webinar, we will be sending out a follow-up survey. And so in the survey, we're going to ask you to confirm your participation as a deputy ambassador. We want to find out who's received their binders and who still needs to get one. So we'll be asking about that. And then we'll be asking if your region has a brochure distribution plan in place already, or if this is something that you'll be developing, and whether you need any help with that.
Perfect. Okay, so before we go out, any last questions? We can do more questions, but anybody have? Oh, we had a question come in about whether or not the app is available in Spanish, and I do not know the answer to that. Or will
I'm sure that I'm sure it's in the works.
Yeah. Okay, pretty good about that. Okay, so Fran's going to take us out and show us about these Learn the Signs activities, scripted, narrated PowerPoints. So the CDC has already done some great short PowerPoints to introduce Learn the Science Act early. And there are a couple of versions, one for healthcare providers and one for families. So we're going to try and take you out there. So this is always the tricky part. Fran, I'm going to make you the presenter.
Okay.
And hopefully this all works.
And I'm going to take you to the CDC website. Are you all seeing the website? It should say information for healthcare providers.
We are.
Okay, so on the last slide, you have a link to the CDC website. And if you want to look, you can see that there are scripted narrated presentations. And there's actually two that are available to you. One is a presentation that's available for family members. Let me pull that up.
And this is the healthcare provider one, I think, that you're going to now. Yeah.
Yeah. And so you'll see that you get all the slides and then you get the script as well. So you do not have to put this together on your own.
And I don't think it'll work. I tried it this morning when a webinar I did it, and we couldn't hear the sound, but you see the little megaphone to the bottom right of each slide. If you click that when you're in presentation mode, it actually reads all of the information that's in the notes. So you don't even have to do the presentation
part. People would much rather hear you.
I'm sure. Yes.
Okay. And then if you just scroll down, then you will also see under Share the Campaign with Colleagues, you will see again another presentation. And this is really for professional to professional. And again, it's scripted. So you can use these as your presentations. You can modify them. And again, if you need any assistance in doing that, the three of us are more than happy to help you with that and to be available. I also wanted to point out that one of the wonderful things, if you've not spent much time on the website, it's like, you know, falling down the rabbit hole. It's like Wonderland in here. Take some time and just tool around the website because there's just a terrific amount of information, both with Learn the Signs Act early, but also with you know, other materials related to child development. But I wanted to show you another door that you could use to get to the scripted presentations. If you go under Multimedia and Tools, okay, you will also see scripted and narrated PowerPoint presentations, and you can access the presentations through this page as well.
Great. So yeah, so as Fran said, there's just a great amount of information on the website. You really do need to set a little time aside if you
Yes.
start to plan to go on there. We had a question about if we're going to send out the links to the presentations. We can certainly do that, and you get on here and you'll be able to find them as well. I'm thinking we might want to do a little support sheet for the ambassadors that lists these things that we've talked about today as well. That would make it easier to find them. So, all right. So, Patty, do you want to take it and give us a little rundown on the recap of the ambassador duties?
Absolutely. And Debbie, would you mind going back to the PowerPoint
Sure.
and pulling those slides back up for me?
Yep.
So we really wanted to make this, basically a part of the work that you're already doing, and identify basically two primary goals or duties for the ambassadors to support as part of this grant. So the first is to support the development and distribution of the Milestone Moments regionalized brochure. So that's the brochure that we're going to customize with contact information for families to be able to use if they have any developmental concerns about their child specific to their region. And again, the LEND trainees are going to be drafting those, and your role as a deputy ambassador would be to proof those, run them by your cadre team members, your regional team, and then give us the go-ahead once they're ready to go and have been approved for printing. And then you'll get them, and based on your regional distribution plan, we'll disseminate those and just report back to us on the web-based survey that we'll send to you quarterly, how many of those have been distributed and to where. And then the second duty is just to provide some presentations within your region on the Learn the Signs Act Early campaign. And Fran and Monica and Debbie provided you with lots of different resources and ways of doing that, from the narrated PowerPoints to just distributing some of the materials in presentations that you may already be doing. Those presentations really will be based on your work and who requests information from you and that sort of thing. So those are the two major duties of an ambassador: to help us with the regional brochure and to provide information via presentations within your region about Learn the Signs Act Early.
Great. Thank you, Patty. We did get an affirmation. Yes, a little support tip sheet would be greatly appreciated. So we can work on that.
I also wanted to mention that Debbie, Monica, and I have developed PowerPoint presentations for many different audiences already. So we've done it for WIC providers, we've done it for home visitors, for child welfare, foster care. So if you're thinking of doing a presentation, please feel free to just shoot us an email, and we may have a presentation that's already put together for that audience.
Right. Thank you, Fran. That was good to share. Okay. Any last questions? I think we've covered our PowerPoint for the day. I can let's see. Patty, I don't know if we put Patty's email on here. That would have been a good idea, since if you had questions about the project in general. But let me get at least to Monica's and Fran's. So I'll leave this up as our last slide in case you want to jot any of that down.
And Debbie, my email address is on the Captain website, but for anyone that may want to write it down now, it's PL Schetter, that's SCHETTER, at ucdavis.edu.
Perfect. All right. Any last closing thoughts? All right. Well, thank you all again for joining us, for volunteering to join us in sharing Learn the Signs Act Early in California. We really appreciate it. It's a greatly needed resource. So
Debbie,
Yeah.
we actually have a question here about
Okay.
when the first quarterly report is
Oh,
expected.
that
That's
is,
that's a great question. I think we have to do our next report to the CDC in March, or I'm sorry, we just did one in March, so June. So we'll be asking you guys for that information before that quarterly report is due.
so you probably think sometime in May, perhaps, that we'd be getting in touch with folks and,
Yeah, late May, early June. I think our report is due in the middle of June. So
okay, great. And that may be something that we'll work out for this little tip sheet too, so you guys have kind of a timeline to be thinking about. So,
As you can tell, this is a tightly choreographed presentation.
we are flexible. That's what we are. So, yeah, and you know, as we hear from you guys and you ask questions, that really helps us to think about things that we might not have thought about before. So that's really helpful. So feel free to send us any questions that come up after you hang up. We'll have, I'm sure, a spot on the follow-up survey that you will be able to give us some other input as well if you've thought of things that perhaps we haven't yet. So, okay, if there's nothing else, we'll get everybody started on their long weekend.
Thank you so much.
Thanks, everybody. Have a good weekend. This is going to end our webinar for today.